But before I continue, I want to pause to acknowledge and thank the many individuals who have spent countless hours bringing this together. It's been no easy feat. The list is long, but atop that list, and I cannot understate her efforts enough, Erin Molnar, instrumental in bringing all of this together. She is the maestro here. So let us take an exercise in using the chat box, or for our emoji users out there, let's give a big round of applause and an expression of gratitude to Erin. It's very deserving. So for those that don't know, nutrition incentive programming is a nationally recognized evidence-based model for increasing food security, for improving health outcomes, and strengthening local food systems. Nationally, there are only a handful of states doing the work to the scope and scale in which we are here in Ohio. We are certainly amongst a small contingent of states executing on a statewide scale and seeing the impacts that we're seeing in Ohio. These impacts are a direct result of the Ohio Nutrition Incentive Network. Beyond the formal coalition that it is a group of committed, intelligent, and impassioned individuals. But this work, nutrition incentive programming, has origins dating back to Cleveland over a decade ago. The programmatic name and brand that is Produce Perks was born out of Cleveland. A shout out to Morgan, I presume she's on here, Morgan Taggart and company, the community stakeholders, the funders of the region. But again, the present day work and the impacts are a culmination of a shared vision of independent programs from diverse regions across Ohio coming together. Before there was a statewide program in Produce Perks, there was a Carrot Cash program in Akron, a Veggie Snaps program in Columbus, a Double Up program in Toledo. We certainly have a history worth telling, but I'm only allotted so much time right now. So for me, the key takeaways are partnership, trust, and working hard at work worth doing. That has certainly been the effort over the years. In 2020, Produce Perks experienced a 96% growth in program utilization, generating nearly $1 million in fruit and vegetable purchases for struggling Ohio households, reaching over 20,000 of them across the state. COVID has certainly exacerbated inequities, increased economic hardship, and food insecurity. We, the Ohio Nutrition Incentive Network, and our partners across the state are proud that Produce Perks was there to help. The help, the relief, and the resiliency that Produce Perks builds for food systems across Ohio are only made possible by the relationships that we hold, the partnerships that we build. We are grateful to the state legislators who champion our work, the foundations and funders across Ohio who have helped catalyze this work, the public-private partnerships that we continue to build, partnerships such as Buckeye Health, who recognize the importance to invest in this work, to lead by example through partnership and alignment of goals. Equitable, effective systems are difficult to build. Failing systems are even more difficult to fix. It requires a recognition of the many parts of the system, the knowledge that we are stronger together. Buckeye Health Plan has demonstrated that knowledge, as has countless organizations and partners across the state. So to conclude, I'd like to thank you all once again. I look forward to the time today to engaging further and expanding upon this work. As Amy mentioned, we are always looking to build the Ohio Nutrition Incentive Network, to bring partners, like-minded individuals in. So please don't hesitate to reach out and engage with us. Again, I'd like to thank Erin and the members of the Ohio Nutrition Incentive Network for bringing this all together. So without further ado, I'd like to introduce our tremendous partner, Kim Scher with Buckeye Health Plan. Kim, I'll let you take it away.
Thanks, Tevis. I have a very brief presentation. If I may, I'd like to share the screen. Terrific. I hope everybody is having a great day. And I will bring up my notes here. I just want to say good afternoon, and I want to thank everyone for the opportunity to share a little bit about Buckeye Health Plan's partnership with Produce Perks. Together, we've been successful in encouraging the consumption of fresh, healthy food in underserved areas for about 3 years now. Buckeye provides Medicaid and Medicare Marketplace and MyCare Ohio health insurance to more than 450,000 Ohio residents. We are Ohio's second largest managed care plan, and we're the state's fastest growing Medicaid plan in terms of market share. We think that Buckeye's success is due to our commitment to what we call whole person care. This means that Buckeye addresses both the physical and behavioral health care needs of our members, as well as many of the social determinants of health that can have a really significant impact on a person's well-being. And as we all know, access to healthy, affordable food is a major SDOH challenge in many urban areas. I know I've heard this, you've probably heard it as well, that it's easier to find grape soda than grapes in the inner city. And unfortunately, that old saying is true. We've heard estimates that about 2 million Ohioans live in low-income areas with high rates of diet-related health issues and poor food access. Through our Buckeye Fresh partnership with Produce Perks, Buckeye is making steady progress on increasing member engagement with farmers markets in their community. We are really working hard to build overall awareness about the importance of good nutrition to good health, and we're also giving people tools like recipe cards and health education and food vouchers and other supports to help them get it on the path to better health. So here's how the program works to make food access easier and more affordable. Buckeye members who live in the area around our farmers markets, our Buckeye Fresh event markets, they receive the opportunity to get $10 in vouchers. And they can use these vouchers to buy fresh fruits and vegetables at their local farmers market. In addition, we try to bring the kids along, so children of Buckeye members, they get to shop too. And they get their own $1 Buckeye buck, so they can go buy an apple or a carrot or a peach or something that they can nosh on while they're at the market. Buckeye vouchers supplement the SNAP and EBT benefits that members have, and Produce Perks, of course, provides that additional match to extend those benefits. In addition, I know Produce Perks has been able to offer $40 TANF vouchers for qualifying families. So if you look at it in total, the amount of funding available to buy fresh fruit at the market, really, it adds up significantly. Excuse me, I have a cold, so you're going to hear all this craziness coming out of my voice. Sorry about that. Buckeye Fresh, just to say, to take a kind of a long view of it, we've really been successful. And that's really shown by the growth that we've had over the past 3 years. This started out as a pilot at one farmer's market in Toledo, and it's grown to a statewide initiative reaching hundreds of Ohioans with fresh veggies, fruits, and nutrition education. So we've got a few stats. As you can see, we've nearly doubled our reach to serve more than 1,300 members. So we're super proud about that. We're constantly working with Produce Perks to enhance and expand Buckeye Fresh. In 2021, we're reaching into Southeast Ohio with the addition of the Athens Farmers Market. Also new in 2021 is the addition of the Buckeye Health Connect van. We are pretty proud of it. Isn't it a beauty? The van rolls out in June, and it's going to bring health care and food and other resources to Ohio's underserved neighborhoods and rural areas. It's scheduled to attend Buckeye Fresh events. We'll be around the state at all these markets, and we're going to bring health screenings and education to Ohio communities alongside our pharmacy partners. So we're bringing pharmacy alongside us. We're branching out in other ways as well. We're building on the success of the Buckeye Fresh Farmers Market program to partner with FQHCs to help our members develop eating habits that directly improve their health. So last year, for example, Buckeye piloted a healthy food prescription program in association with our provider, Lower Lights of Columbus. Our participating members, they received individual nutrition counseling, they had monthly weigh-ins and checkups, they got healthy recipes and food boxes, and they also got a monthly stipend that they could use to buy fresh produce. It was a great program. Our members lost weight, they reduced their cholesterol and their A1C levels, and they reported feeling more energetic. And so we've renewed this program with Lower Lights in 2021. But what's more, Produce Perks has helped Buckeye expand the healthy food prescription model by creating a new partnership for us with Mercy Health in Toledo. This program aims to decrease food insecurity among pregnant women and help achieve better health, birth outcomes. So at the end of the day, even though we have lots of data to tell us that our partnership with Produce Perks is making a significant positive impact on many lives, it's the personal testimonials of our members that really give meaning to our work. It's why I get up and go to work every day, because I love this. I'd like to end our conversation a little bit with a comment from our member, Jennifer. And here's what she said. She said, any incentive to help me eat right is a bonus, especially the fresh stuff. I told everyone I knew about Buckeye Fresh events. This was awesome. So thank you. Thank you for being awesome. Thank you, Produce Perks, for being awesome. Thank you for allowing Buckeye to be awesome along with you. We really appreciate the opportunity to share the work that we're doing with you today. And we look forward to an exciting year ahead as more farmers markets come online and as we continue to innovate in partnership with our good friends at Produce Perks. Thanks so much.
Thank you, Kim, and thank you, Buckeye. It's been an amazing partnership and really excited to walk alongside you in development of those Buckeye Fresh events. So hello, everybody. My name is Anna Bird. I'm the Director of Programs with Produce Perks Midwest, and I'm going to give you a little bit more context about our programs and some of the impacts that they've had in 2020, especially, along with the help of our program evaluator, Lauren Vargo, in a few minutes here. So in case you're new to our work, what are nutrition incentives? They are evidence-based models that incentivize the purchase and consumption of fresh, healthy produce. They are supported at the national level by the USDA, written into the Farm Bill as a line item. They've been around for a while, different types of models to incentivize the purchase of healthy foods by low-income consumers. And pretty much every state across the country has some form of nutrition incentive programming. Like Tevis mentioned earlier, Ohio is one of the most robust programs at a statewide level, seeing the highest purchase of fruits and vegetables through the program. But all of our neighboring states have some form of programming as well. We have three main programs across the state: the Fruit and Vegetable Coupon Program, which I'll talk about a little bit later, the Produce Prescription Program, and then the Produce Perks Program, which is our flagship SNAP matching program. Tevis also mentioned a little bit about the history of these programs within Ohio. So the oldest incentive programs began in 2000 and around 2010 in Cleveland, Toledo, and Akron, followed by Cincinnati and Columbus in 2014. And today we've grown to a statewide program through the Ohio Nutrition Inventive Network that impacts 35 counties across the state. These programs are important because Ohio has one of the higher rates of food insecurity in the country. We rank 6th for individuals that are receiving federal food assistance dollars, or SNAP. And in 2020, for sure, we're one of the hardest hit economies by the pandemic. So we have a lot of individuals, families, children that are struggling to afford their next healthy meal. During the pandemic, Feeding America estimated that food insecurity within Ohio increased by about 30%. So over 2 million individuals across the state are struggling to afford those healthy foods and to feed their families. In particular, child food insecurity grew very significantly at 42%, meaning that 28% of children in Ohio are food insecure right now. So these programs, nutrition incentive programs that provide those financial resources to individuals to make those purchases, are very important to making sure that our communities are healthy and our economy starts to recover. And so it should be acknowledged that the programs that we offer don't just put those financial resources into the hands of the individual and don't just impact that individual in being able to purchase healthy foods for their families, but that also those dollars are going to support local farmers, Ohio-owned businesses, and our communities in their economies. A recent study was published by Colorado State University that showed that incentive programs have a significant economic multiplier effect. So using their their data from their paper, we can estimate that just in 2020 alone, our programs have put almost $2 million additional dollars into the economy. So I'm going to stop here and let my colleague Lauren Vargo from Case Western Reserve University tell us a little bit more about the Produce Perks program and the impact that it had in 2020.
Thank you, Anna. Hi, everyone. I'm Lauren Vargo. I am the program manager at the Marianne Swetland Center for Environmental Health at Case Western Reserve University, based in Cleveland. So as Anna touched on, Ohio Produce Perks, harvesting health in the heartland. Produce Perks increases access to fresh fruits and vegetables for food insecure communities. And it does this by matching customers' SNAP or EBT dollar for dollar up to $25 at participating sites. And with Produce Perks, recipients can buy fresh fruits and vegetables at both grocery stores and direct-to-consumer sites. The map on the right is showing you all of the different counties that we currently have sites operating the program in. So one thing I always like to do is ground ourselves in what is happening in SNAP, because this program is dependent on people spending their SNAP dollars. So on the screen, you'll see from 2017 to 2020, how many people and the amount of money nationally that was spent on SNAP. So from 2017 to 2019, we are seeing a decrease in the amount of people and the amount of benefits. And then 2020 hit, as we all know, a global pandemic. And the last stat that I heard was in July of last year, there was 6 million Americans that had applied for SNAP benefits that were not previously enrolled in SNAP. So a lot more money going to the SNAP program and allowing people to buy more foods. So taking us back again to 2020, starting March 15th is kind of when everything started to come down. And we started seeing, at least in Ohio, Governor DeWine saying that we're no longer going to be kind of living life as normal. Produce Perks Midwest, 3 days later, made an amazing decision to make the program match unlimited at direct-to-consumer sites and a $50 match at grocery stores. So when I say an unlimited match, truly unlimited, people could match. They would go to a farmer's market and they would, if they spent $300, they could get it matched $300. So this is a lot of money going to people that need it, as well as it's being spent at the markets for vendors and farmers that are also in Ohio. Some other important dates, April 22nd, SNAP benefits increased 40% federally. So meaning some people were getting about $15 a month. That was increased to about $190. So more money in the pockets of SNAP recipients. On May 12th, pandemic EBT was a program for any school-age children that were getting a free or reduced lunch. The program was announced and children were sent cards. The parents of children were sent cards, or if they were already SNAP recipients, they would get the benefits uploaded onto their card for the school year. On June 30th, the unlimited program match did end. And then we'll see a little bit more of the impact of kind of that time period and what happened after in a moment. And then September 11th, another round of pandemic EBT was approved. And you can see a stat up at the top about the impact of the pandemic EBT program in Ohio. So as mentioned, we are the evaluators of the program. So we do conduct evaluation studies. And one that was really valuable was our cross-sectional survey. So what this is really asking is what predicts use of a SNAP incentive program? And what are the characteristics of people that use the program at the different locations that are available to them? So we spoke with SNAP recipients that lived in 2 different areas in Ohio that lived within a 5-mile buffer of grocery store and a year-round farmer's market. So this allowed us to look at people that have similar access to a Produce Perks site and speak with users and non-users of the program. And then taking it a step further of the users, looking at users of only grocery store programming, farmers market, and those that are using it at both. And then finding kind of similarities, differences, or any characteristics of those different groups. As we plan to take this study to 2 different areas in 2020, obviously everyone was impacted by COVID. Whether you were on SNAP or not, I'm sure we all experienced going to the grocery store and not being able to find bread or pasta or whatever it was that you wanted. So we went back and surveyed the same people from the first year and asked them some questions about how the COVID-19 pandemic has impacted their food shopping, their food procurement, so maybe buying online or some other options. And I'm gonna head into kind of some 2020 program results, but if this has really piqued your interest, as I am super excited about these findings, we will be working on some manuscripts and some other things that will be coming out soon. So feel free to take my contact info at the end and keep a lookout for these studies, as I'm sure Produce Perks Midwest will also be sharing them. So what happened in 2020? Compared to 2019, you'll see that the amount of incentives distributed as well as redeemed doubled. And the amount of participating sites actually was slightly less. This was due to multiple factors, kind of natural fluctuation on and off the program, as well as for some farmers markets, they were in areas that maybe they couldn't open up safely or within the kind of Ohio physical distancing rules and such. So moving to direct to consumer sites. As the title says, direct to consumer, so directly from the farm to the consumer. That can mean a farm stand, a farmer's market, a CSA model, or a mobile market in this context. So the program works typically at a farmer's market by a customer going up to the market manager booth. They swipe their card for whatever amount that they would like, and then they get their match. So if they spend 25, they would get 25 in Produce Perks, walking away with $50. SNAP tokens can be spent on SNAP eligible items, whereas Produce Perks can only be spent on fruits, vegetables, herbs, or edible plants. So taking a look at SNAP sales from 2016 to 2020, you can see that we were seeing a steady increase over the past 4 years and then a huge jump in 2020. So the unlimited match started in March and continued through June. We saw a slight dip in July when the unlimited match stopped, but amazingly, it picked right back up, actually higher than it was in June, and then continued to stay higher throughout the rest of the year and actually into where we are now, May of 2021. Program growth was also seen in the amount of unique customers and the amount of Produce Perks purchases. So this shows 2019 compared to 2020, seeing a 71% increase in SNAP sales and an 82% increase in the amount of Produce Perks purchases at farmers markets. And so personal plug, we just published a policy brief that you can find on our website that really takes a look at how Produce Perks responded to the COVID-19 pandemic specifically at farmers markets. So the three stats that you see here are the increase specifically from March through June at direct-to-consumer sites. So SNAP sales increased 173%. Produce perks, incentives redeemed, increased 72%, and the amount of unique customers increased 37%. Some visuals as well. So the left-hand side is the map of customers, so SNAP dollars spent by customers. We do collect zip codes for those that are comfortable providing it. And so this is showing where customers, their home zip code, and then how much money they're spending SNAP at the market. You can see that obviously some more of Ohio is covered, which is wonderful, but I would like to take your attention to this bottom number here. In 2019, the top amount spent by one zip code was $10,000, whereas in 2020, it increased $6,000. So that's more money being spent by customers. Switching over to vendors, right? So we all go to the market, we can be the customers, but you have to have the people there with the product to buy. So the other important part of farmers markets, the vendors. So this graph is showing the amount of SNAP sales. So the SNAP sales actually to a customer, so how much SNAP dollars customers were swiping off of their Ohio Direction card in blue versus the amount of reported SNAP. So at the end of a market day, the vendor will go back to the market manager and say, here are all my SNAP tokens. So the actual money in the pockets of vendors. And that's represented in gray. So really positive that in the last 4 months of the year, it was about equal or a little bit more. So we're seeing customers really using all of the SNAP tokens that they got throughout the year. This map represents kind of the total impact of the program. So from vendor zip codes, the SNAP and incentives redeemed by vendors. This is really exciting because if you recall in the customer map, there were maybe some areas that were a little less white or a little less colorful because people may only have one market to go and shop at. They may not have reliable transportation to get to anywhere else. But our vendors and farmers are traveling from different parts of the state, which tells a much broader story of how impactful this program really is. And again, I will take your attention to this last number, where in 2019, we had $20,000 was the max per zip code, whereas that doubled in 2020. So the other side of the program where it is operating in grocery stores. So these operations are a little bit newer, piloting in 2017 and then really kicking off in 2018. Ohio is a leader in operating SNAP incentive programs at grocery stores across the state. So how does this work? Totally different than farmers markets. And there's also two different models that Produce Perks Midwest uses. And this is really dependent on how the grocery store is already operating and how the program can best fit into their operations. So if the store has a point of sale system that can be updated, they use an automated coupon delivery method, which would print out the coupon after a customer purchases more than $5 worth of produce with their SNAP card. And then there's also the manual coupon delivery method. So a write-in voucher of whatever amount the customer spent up to $25, or these also come in $5 increments. So taking a look at incentive trends at grocery stores, 2019 compared to 2020. Again, we are seeing a huge increase in the amount of incentives distributed, as well as a doubling in the amount of incentives redeemed at all participating retail sites. Also, so many more SNAP transactions when a Produce Perks coupon was actually redeemed, which is very exciting. and about the same amount of participating stores from both of the years. I also want to highlight the redemption rates for these two models. This really is just the amount of incentives redeemed divided by the amount of incentives distributed. So we're seeing that there's a similar redemption rate from 2019 to 2020 for the automated coupon delivery method. While that is the same, know that the amount of incentives redeemed doubled. So super impactful to the communities and the individuals that are using the program, which is a lot more. And then as for the manual coupon delivery method, we're seeing a big jump in the amount of coupons redeemed. And I don't know about you guys, but normal coupons, I really have never used them. It's about 1% redemption rate for like a normal coupon at a grocery store. So 23% or 56% is a big deal that people are really bringing this back. It's a huge motivator for them to come back and buy fruits and vegetables at these grocery stores. And to end on a very exciting note, this was one of our findings from our second year survey that I mentioned earlier. We are seeing that from our year one group of participants to our year two, an increase in food security. So on a food security scale, 0 means that you are completely food secure, whereas 6 means you are completely food insecure. So in year one, with the participants we spoke to, they had a higher food insecurity rate than they did in year two. And we also see that when we look at users versus non-users in our year two data, program users have a greater increase in their food security. And that is all for me. Like I said, if you would like to see more updates or hear more updates on the work that we are doing evaluating the Produce Perks program, please feel free to email me or sign up for our monthly newsletter.
All right, thank you so much, Lauren. So I'm going to open it up for questions in a minute, but before I do, I just want to briefly highlight 2 other programs that operate across the state currently, and one in particular, the Produce Prescription Program, that has deep roots also in the Cleveland area, Youngstown area as well. So Produce Prescription Programming, which is the second of our 3 programs, is also a national evidence-based model that is funded at the USDA level. We receive state funding currently to implement programming with pregnant women to help improve birth outcomes. And if you're interested in learning more about that, we have our Produce Prescription Program at 1 o'clock today. We'll make sure all those links are in the chat if you haven't registered. So with Produce Prescription Programs, it's not limited like the Produce Perks program to a SNAP recipient. We work with clinicians to identify food insecure individuals that are also struggling with some kind of diet-related chronic disease like hypertension or diabetes, etc. And then that clinician provides a monetary prescription that individual can then go and purchase produce. We're also experimenting. Our Youngstown partners are doing produce delivery models as well. And we're also doing that in Cincinnati to get the food directly to the door of the patient. These programs deeply invest in the health of the patient and have very measurable outcomes, both on food security rates, of course, and then also on health biometric outcomes as well. And then our last program is a pilot program from 2020. We received state funding to help individuals that are food insecure and also have children in the household afford more fruits and vegetables. If you're interested in learning more about this program, that presentation is at 2 o'clock. And so this is a new program, tried some different things, both delivery and also coupons that can be used at farmers markets and grocery stores. And I'm excited to talk a little bit more about it at 2 o'clock and have more partners join us. we were able to get out almost $60,000 to eligible individuals in 2020, spent mostly at farmers markets, but also some grocery stores. And I think there's a lot of potential in, again, reaching individuals that are food insecure, but may not be eligible for SNAP. So there's that little, when you're making just enough money that you can't receive SNAP benefits, but you are still struggling to meet your family's food needs. So just a plug for those two programs in later sessions. So we'll go ahead, open for questions. If we have any questions in the chat, our moderators can bring those to our attention. If you would like to speak, you can go down to the reactions button at the bottom and raise your hand, and we should be able to flag you and invite you to unmute yourself as well. Have we had any questions, Erin? I did see that a link to that data brief was requested, and Lauren looks like pasted the link, so definitely check those out. We'll probably email that around as well next week to everyone who attended. I don't see any hands raised, but I don't know if you want to just unmute yourself to ask a question, that's fine also.
I have a question. Unlimited match. This is Rachel Ward with the Farmers Market Coalition.
Yeah.
And we're finding we work as part of the Nutrition Incentive Hub with nutrition incentive programs across the country, and we're finding that a lot of programs lifted their match or made their match unlimited during COVID, and then are struggling to kind of figure out how to go down from that or how to analyze the impacts of that. So I wonder if anyone could speak to your decision to both like raise that to be an unlimited match, and then if you met any resistance as you had to kind of pull it back down, and if that was completely a funding choice, or if there were other factors and why you decided to bring the match back down.
That's a great question. Tevis and Lauren, do you maybe want to give some answers, Tevis, to maybe the motivation and kind of our decision making and lifting it and then bringing it back, and then Lauren, if there's any data that would be relevant as well.
Yeah, I can certainly speak briefly to it, and thank you, Rachel, for the question. And Anna, feel free to jump in as well. But yeah, the match was released as an immediate response to address food insecure needs right during COVID. And as we were seeing the utilization rates, but we were also monitoring the average SNAP spend happening at farmers markets and so forth. So a combination of being mindful of budget supporting the work, as well as what that average SNAP spend was at participating markets. Rachel, we landed on our $25 cap match. It was $23 and change, Anna, if I'm not mistaken, as to what we saw as that average SNAP spend at participating market retailers, and thus ended the unlimited match at the end of June and put in place a $25 cap match, which was an increase from the previous pre-COVID match. I'd open it up, Anna, to you and others to speak a bit more to that. But Rachel, that's how we determined those numbers and landed on what we did.
Yeah, and I touched on this a bit, but we're seeing in the data that there truly were customers spending $300 and then getting a match. And so just really thinking of that from a market perspective. One, we use physical tokens at the markets. So that is like a wheelbarrow full of tokens that people are having to carry around. And also the staff at the markets are having to count that out. So it adds a lot more time that they're having to spend doing that at the market, when a line is forming, as well as before or after. So I think on the financial side of the decision, that's more Produce Perks Midwest, but we are seeing on the data side that the average amount spent was, as Tevis said, around $23. And it was a $20 match before that time period, which was a decision that actually before 2018, it was $10. So it had been doubled because we were seeing that SNAP purchases were higher on average than $10. So I think the match at $25 has been a really good fit for markets.
Lauren, another thing that I would add to that is the fact that, and Anna can chime in on this, we actually had to make emergency orders for more tokens because we could not supply. We were actually going from vendor to vendor, getting tokens from them so we could reissue them. So yeah, that the unlimited was a crazy time there.
Thanks, Dan.
Yeah, thank you. I think it feels like 20 lifetimes ago, but I believe that we made sort of that timeline decision and put that on all of our marketing materials ahead of time to kind of help individuals with expectations of when that unlimited match would end as well. And if any of our market operators have feedback to how that was received by customers, if you want to pop that in the chat, any stories of that, I think that would be great to hear. I saw another question about how we track health outcomes in the prescription program and whether or not it's self-reported. And so we do kind of a two-step process to collect that information. So we collect self-reported information about food security. So we use a survey screener to screen food security pre and post program, which is self-reported. But then we do work with the clinicians for them to report the health outcomes that we're monitoring, whether that be weight or blood pressure or other indicators of improved health as well. So we do a combination of self-reported, but then also work with the clinician to get that data. Okay, I think unless there are other questions, unmute yourself now if you'd like to ask. We've got all the links to upcoming sessions in the chat. If you haven't registered, there's still time. Just register and you'll get emailed the link quite shortly. Up next, right away, if you're interested, we have a panel from market managers that talk about adaptations that their markets had to make during the pandemic. Very interesting content from a couple of our leading farmers market managers from across the state. And then we've also got our produce prescription program here at 1 o'clock. So we hope to see you in one of those two sessions. So wonderful to see so many faces, and thank you for joining us for this keynote presentation.
Thank you all. See you soon.